Physicians Association has withdrawn all emergency and OPD services in public hospitals across the country. The industrial action is over what they describe as government's reluctance to address their poor working conditions. A statement to members directed them to observe the strike until government fixes salary discrepancies, career progression and other demands. JoyNews' Roland Walker has been to the Mamobi General Hospital and some facilities and now reports.
At the Mamobi General Hospital, we're told that towards the end of last week, they joined the numbers across Ghana to be part of that strike action. It has brought some untold difficulties in the general medical treatment for patients. Now, this is what we're trying to do. We'll first go to the OPD, try to interact with a number of patients, because a number of these patients were referred from the last week to come for treatment this week, just because sometimes when they came, the medical doctors were not available because they had to look to other patients for treatment, and then they also had to get on to some other issues administratively, and that's the difficult part. So we have a number of patients who are here, and the camera will just give you a vivid look at what the atmosphere. This is a records department, but also means that this is where you first get your records. If you have an inventory or document here, you get to have this document first, just like we do for all OPD issues, and then you get to the consulting room and speak to a medical doctor. But let's interact with some of the patients. And let me just scan and say, okay, let me speak to mom here. Ma, good morning. That's saying. Now, free fans and our hospital. Okay. Now, Oba, how many minutes?
50 minutes.
Okay, I didn't hear about the so bit me a catch him.
Oh, me patron, me ya dinner Friday sugar me now.
Now, you answer now, but notice say na physician assistants was striker now.
Be an element and appointment news. And
shut can news, Musa, but
to me, do Helena walk and I'm
you Nina in Chelsea. And see, you ever pie say, you ever shaman apple. Okay, so basically, she brought a Ben case here, so she wants to get her folder as it is, and then she wants to go and see a doctor. But let's speak to some other well, customers, so to speak, because they're customers really. And let's get to speak to this gentleman. Good morning. What's your name?
Raphael.
Raphael. Yeah. How long have you been here?
30 minutes.
30 minutes now.
Yeah.
You brought a simple case, malaria or what?
Yeah, I have an issue with my ear, so I'm coming to
get some treatment.
Yeah.
And when you were coming, did you know that physician assistants were on strike?
Not really.
Okay, so this is the first time you're hearing it?
Yeah.
Okay, but 30 minutes, are you getting any indication that you'll be served soon?
Not really. I just came here, so I haven't gotten any information yet if I will be served.
So we wish you all the best, yeah? So the patients are here in their numbers, but we're also told that a number of them came from the last week. They hadn't been given the needed treatment just because of the load of work. And as a result of that, that news has been ongoing. So you find that many of the benches have been empty as it is. But, you know, treatment has still got to go on, and the medical doctors are at the center of many of the treatments that go on. And along the way, we'll also get to speak to some medical doctors as well. So let's quickly go to the consulting room of the doctors and get to speak to one, so to speak. At least when we get the head or even the deputy, we'll be happy. But that's the situation. We have the pharmacy department. They are ready. They are not on strike though, but that is the situation at the Mamobi General Hospital. Let's see. Okay, we've got into the first consulting room. Now, this one is consulting room 4. Let's see whether we can get to the next one. Okay, we've got into consulting room 3. And let's see whether we can speak to a medical doctor who is working. Okay, so now you're entering consulting room 3. Luckily, I have a medical doctor here. Now, let me just get an interaction, so to speak. And she's busy, just working, looking at. And currently, what's your name, ma'am? Your full name?
My name is Dr. Salamatu Atanantokma.
Okay. And what are you doing now for the patient?
Oh, we are doing our regular consultations. It's Monday morning, the patients are coming in, so we are seeing the patients.
We came here basically because we are told that there's a strike action by the physician assistants, and we know that they complement your efforts. Of course, they are not medical doctors, but then they are very critical to your work. How many do you have at the hospital?
In this hospital, we have 5 main physician assistants, but in the meantime, 2 of them are on leave. So there are 3 that are supposed to be at post. So the 3 physician assistants are those on strike at the moment.
Usually, what is their importance at a public hospital setting, or any hospital for that matter?
Depending on the hospital, the role of a physician assistant may vary. In our hospital, mainly our physician assistants help us at the outpatient department. They help us with running our special clinics too sometimes. So mainly in this hospital, their role is around the outpatient department.
Would you classify their role as important, and why?
Oh yes, their role is important. Everybody in the healthcare delivery system has a role to play, and their role is important, as I say, especially in a setting that you don't have enough doctors all the time. We put them on our roster. They run emergency duties as well. And then, like I said, our special clinics and our OPD. So they are important. They complement our work from day to day.
Now, them on strike means that it's having a toll a bit on the pressure, because I know Mambobi is located in a dense area in Accra.
Yes, it is having a toll on the patients and how we see patients and the waiting time of the patients and everything, because our OPDs, we have to restructure how we run the OPD. The doctors have to do a little bit more to be able to cope with it. It's having quite a toll. Last week, going by their roadmap of the strike action, they were still doing emergency duties, so they were still around. But today, we realize that they probably will not be around at all until their grievances are addressed. So yes, it will have a toll on waiting time, on even probably how many hours we'll run the hospital today, whether we'll be able to keep up with running a 24-hour duty today.
It all has an impact, 24 hours or not.
Yes, I mean, it's because you have them on the duty roster at different times. So if we don't have the full force, then definitely it will affect how many hours. In this hospital, I mean, probably our maternity or our maternal health unit is mainly run by doctors. So for that aspect of the hospital, things may not change. But in the outpatient department, yes.
So that's the story at the Mamobi Hospital. Definitely stay with us here on Joy News. We'll be visiting other health facilities and let you know the impact of the strike on our health sector.